Welcome back to the WHHI Daily News. Dr. Debi Lynes has joined us once again for her Mind Your Health segment. And today we're talking about parts. I'm not really sure what that means, but
Parts.
Debi, you can explain.
Exactly. Parts. Parts mean.
What do you mean?
You know, we are all born with a belief system. And we get that belief system or schema as children, okay, within our environment and the way we're raised. So we all sort of go through life with this belief system. And I'll give you an example. If my mom is strict, I'm going to learn that if I make my bed and do what I'm supposed to do, I'm going to be allowed to do things. So my brain will go, okay, so if you're around a strict person, maybe if you do this or this, you know, this will happen, I'll have a positive outcome. So within our brain, there are all of these different beliefs, and I like to call them parts of us.
Okay.
I have a critical part of me. I have a goofy part of me, right?
Okay.
I have a part of me that might be a little bit afraid of things.
Right.
I have a perfectionistic part of me.
Okay.
And our parts are developed throughout our lifespan, but mostly through our developmental age based on our experiences.
More than heredity.
It's a threefold, it's trifold. It's biological,
Okay.
psychological, and environmental. So my environment is going to shape what I think and how I feel, and it's going to trigger my genetic predispositions, if that makes any sense at all.
Right.
Okay.
Sort of.
So what I experience from my mom and dad in school and church or whatever is going to influence what I think and feel, my psychological makeup.
Right.
And then it's going to, if I am feeling insecure in a social action, and I'm in a social situation. I feel insecure. I have a beer because I'm 21.
Yep.
Okay, that triggers a predisposition to a dependence on alcohol. So my genetics are now involved. So it's this big kind of triangle, and so each of us have these parts of us. There is no bad part. We don't have a bad part. All parts are coping. All parts are adaptive. All parts are trying to keep us safe.
And healthy. And can we change?
Yes.
Can we work on our parts?
We work on our parts all the time because if most of your parts are developed when you're younger, they're going to be parts that are going to develop through the lens of children.
Yes.
Right?
Yes.
So I'm going to see things from a different perspective. I'm going to see things as a kid. I'm going to see things as a 15-year-old. I'm going to see things as a 17-year-old. Okay?
Yes.
So as I get older, 21 and older, as I develop into an adult, oftentimes my parts don't shift.
Right.
Okay? I'm going to be still worried if I'm 30 minutes late. Because if I was 30 minutes late before, there was a negative consequence for that. And so I think what we're trying to understand, I know we're going all over the place, it's really pretty simple. We all have different parts and personalities within ourselves.
Right.
When we really examine those and don't judge them as good or bad, okay, and recognize that we can shift them to adapt. So some people who drink, that's the avoidant or insecure or part of them that wants to numb, avoid, and escape. Makes sense. Not adaptable, not necessarily adaptable. It might be maladaptive, not the healthiest way. But once I recognize that taking that drink, if we're talking about substance use, is my body trying to protect myself, then I can shift it to maybe something that's a little healthier. Go for a walk, stop drinking, do things that are a little healthier. It's really a fascinating study.
It is, and really it's self-analysis.
Correct.
It's really understanding really who you are, where you've come from, where you want to go. And sometimes talking with someone like you perhaps will help you to discover some of those insecurities
Exactly.
or those parts.
And the interesting part is once you study with someone you
right.
practice with someone, the goal is that you can take that information and move on and by yourself examine your parts. What's working for me and what's not. Again, not judging good or bad. It is what it is.
Yeah, it is what it is. We are what we, what we are.
Yeah.
Friends, colleagues. Thank you, Debi. Great job, as
Thank you.
always. And we'll be right back with more news. Don't go away.